This week, Minnesota lawmakers passed their session's main health bill, but left some of the year's big questions unanswered. Welcome to the May 8th edition of Healthline, the weekly news podcast from the Minnesota Hospital Association. I'm Tim Nelson.
And I'm Abby Mocktig.
The Minnesota House passed a supplemental health budget on Thursday, mirroring a bill passed in late April by the Minnesota Senate, but with some changes. The bill set last year's historic and controversial federal health policy changes into Minnesota law, but the bill fell short of many state initiatives that DFLers and Medicaid advocates had been hoping for. Failed proposals included a state blink-off if federal changes are repealed, extended lookbacks for Medicaid eligibility, and reports on beneficiaries that lose coverage. Health Committee co-chair Jeff Backer led Republicans that fended off hours of amendments on the House floor. He said the bill already reflected Minnesota values.
You know, if you look at Minnesota, we have a very generous welfare system. We have SNAP, we have different other programs, MFIP, CCAP. So we want to help people. At the end of the day, we want people also to feel good about themselves with the work requirements. And that's really what this bill is about. It's our values that says, if you can work, you should work.
DFL Health Committee co-chair Robert Bierman urged lawmakers to resist the federal changes and vote against the bill.
We're now in a position where each day fewer and fewer Minnesotans have health care coverage, where more and more clinics and hospitals are on the brink. There are growing swaths of this state where people simply cannot receive the health services they need and have nowhere left to turn.
Of particular note, a Republican and a Democrat amendment to force drug makers to fully comply with the federal 340B drug pricing program were both ruled out of order on the House floor. The Senate did approve a similar measure on a bipartisan basis last month, and it could return in a different form later in the session. The health bill's passage came despite pleas from providers to soften the impact of H.R. 1, the One Big Beautiful Bill passed by Congress in July. An advocacy group, This Is Medicaid, said the parebacks in federal health assistance could come at a price and warned maternity care is particularly vulnerable. More than a third of births in Minnesota are to Medicaid beneficiaries, and the number is nearly 2 in 5 outside the Twin Cities, according to KFF. Rick Ash, the CEO at the United Hospital District in Blue Earth, said at a This Is Medicaid press conference Wednesday that the impacts of hospital financial struggles are already visible and will grow.
When I came to UHD 11 years ago, every county around us had an OB program and several deep. And since then, in Minnesota, 19 labor and delivery programs have ceased. And I am aware of a few others that are very close, and a couple of hospitals as well, small critical access hospitals. This is not a trend. This is a crisis.
Also missing from major legislative action this week, a much-debated rescue plan for Hennepin Healthcare. Yet another sales tax proposal emerged at the Capitol as the Minnesota House continues to debate how to respond to a budget crisis at the state's largest safety net hospital. The state Senate last week approved a $150 million plan for HCMC that also included more than $100 million for other hospitals around the state. Hospital leaders said this week a recent spike in uncompensated care across Minnesota, up by nearly a quarter from 2023 to 2024, showed the need for help for HCMC, but also other providers. Rick Brewer, CEO at Community Memorial Hospital in Cloquet, spoke during a 2-hour WCCO radio special report about the financial struggles facing providers across Minnesota.
The state is considering an uncompensated care pool that for many of these facilities, they're dealing with a big spike in uncompensated care, and it's only going to get worse. That would be a big step in the right direction, especially for those severely distressed hospitals that are just worried about truly, as we speak, how are they going to keep their doors open through this spring, through this month?
And amid all that, there was turmoil in the state's Department of Human Services as scrutiny increased on Medicaid fraud by federal officials. Abby Mochtig has more.
Governor Tim Walz this week withdrew his appointment of Shireen Gandhi to serve as the commissioner of DHS through the rest of 2026. The move came just hours before she was set to face a confirmation hearing in the Minnesota Senate. The Star Tribune reported that Gandhi may not have had enough DFL votes in the Senate Health Committee to proceed with a floor vote for her confirmation. Walz said Gandhi would remain with the agency and Deputy Commissioner John Connolly would succeed her. But NPR News reported that Connolly was going on medical leave to undergo cancer treatment and that Gandhi would be his temporary replacement. The shifts came just days after FBI raids on autism and daycare providers in Minnesota and the suspension of an additional $91 million in federal Medicaid funding, citing ongoing fraud concerns in the state. It also came as Walz's likely successor as DFL gubernatorial contender, U.S. Senator Amy Klobuchar, said at a press conference that she would have acted more decisively on fraud allegations if she'd been governor.
The Minnesota legislature, by the way, has 10 more days in this year's regular session. They have to wrap up votes by next Sunday. And that's it this week from Healthline, a weekly news podcast from the Minnesota Hospital Association. I'm Tim Nelson.
And I'm Abby Mochtig.
Thanks for listening.